In this lecture of orthopedic rehabilitation protocol, the joint, the pathology we will discuss is the hip osteoarthritis. Joint is the hip joint. Osteo means bone and arthritis means inflammation of the joint. Osteoarthritis is a degenerative type of arthritis that occur most often in the people older than 50 years of age. It may also occur in the younger people, like due to sickle cell disease patient. The hip osteoarthritis. Osteoarthritis is a condition that occurs in the elders population. Always remember. The characteristics of this disease is the pain and stiffness that worse in the morning or after prolonged sitting. This is the most common complaint of many patients. Pain in groin or lateral around the hip may also occur. Pain that flares up with vigorous activity. Pains increase with the vigorous activity. Locking or sticking of the joint also its characteristics, and a grinding noise, that is the crepitus. Noise also seen because the joint space become less, and when the patient move, uh, these grinding noise occur. Decrease the patient range of motion in the hip may cause limbing. Okay, the hip osteoarthritis is the pathology we will discuss. It is the degenerative type of arthritis, mainly occur in the older population. Pain and stiffness occur especially in the morning. Pain occur with the vigorous activity. Locking or sticking of the joint also occur. We also hear noise because the joint space is reduced. When the patient move his leg, the uh, grinding noise also hear. Decreased range of motion in the hip also has its characteristics. Decreased range of motion also the reason is joint space become less. The muscles is weak. Always remember, in this condition the muscles become weak. What is the physical examination? Physical examination is very important for every disease. Tenderness over the hip. Tenderness means patient feel pain when we palpate over the area. Limited range of motion in one or more of the hip. Abduction, flexion, extension and adduction. All the movements of the hip, there is limited range of motion. Pain when pressure is applied on the hip, and there is also a gait abnormality. Walking pattern of the patient is abnormal. These are the examination. Physical examination of the hip osteoarthritis is these are. The test we do is the cluster of Sutcliffe test we do for the patient. These are the 6 points. So let us discuss. At first, patient spine, flex the hip knee to the 90 degree, move the hip to the opposite shoulder and apply pressure to the femur. When the patient feel pain in the groin, this is the condition this is the test become positive. Patient becomes spine, flex the knee to the 90 degree, move the hip to the opposite shoulder, and when the physiotherapist apply compression, patient feel pain. And in the next position, next image, you can see from the same position of step 1, move the hip into internal rotation. In the first, we don't go for internal rotation. In the second, we do internal rotation, apply compression while moving the hip into adduction. Assess the patient's symptoms in the groin. These are the 2 tests. And the third we do is the patient in the prone. Flex the knee into 90 degree. Also perform internal rotation of the hip and measure the range of motion with the goniometer. Then the positive sign if the hip internal rotation is less than or equal to 25. This is the picture. And the fourth test is the patient report pain when squatting. This is the position when the patient squat, and if he feel pain, then this is the positive sign of the osteoarthritis of the hip. And the fifth test is the active hip flexion causing lateral pain. And the sixth test is the active hip extension causes pain. Active hip flexion and extension become painful. These are the tests to diagnose osteoarthritis of the hip by the physiotherapist. Hip osteoarthritis rehabilitation. Note: always adhere to the local protocol. First we go for intervention. What is the intervention? Intervention differ in each patient according to its history and patient status. Depend on the patient condition, patient age, his history, intervention become vary. Minimizing the activity that aggravate the patient condition, such as climbing the stairs, because the patient joint space is reduced. Climbing the stairs make the condition painful. Hydrotherapy with exercises to decrease the weight on the hip. This is very essential. Hydrotherapy. Strengthening of the hip and the surrounding muscle is also effective because the muscles is the weak. So strengthening of the hip and the surrounding muscles strengthen the muscles and the patient range of motion and the activity of the patient become improved because the muscle becomes strengthened. Icing if there is acute phase and heating if there is the chronic phase is also beneficial. Assistive devices we use is the walking supports like the cane, crutches or the walkers, so that joint don't overload and the patient activity of daily living becomes smooth. Long handle reaches to pick up low lying things. This is the object for the patient assistant. And in this lecture I will discuss the hip osteoarthritis, what is, in which patient it's common, its characteristics, physical examination of the osteoarthritis, also discuss the test, and we also discuss the rehabilitation of the patient. And this is the question: osteoarthritis occur in which age? This is the very important question. Answer this question in the comment below. Thank you.